I'm Dr. Drew Robertson. I'm here to talk to you today about the realities of healthcare in the midst of the great healthcare debate that is taking place in our society today. We hear much in this debate, and I've noticed that a few voices are not being heard. That includes both physicians' and patients' voices, and I'll be addressing that further. As I speak, I'm going to be referring to a critical resource in this debate, and that is a book called Who Killed Healthcare, written by Harvard business professor Regina Herzlinger. Professor Herzlinger has studied healthcare systems around the world, including ours. She's very thoroughly versed in the problems that we have in our healthcare system and with the problems and solutions offered by other systems. This book, Who Killed Healthcare, contains valuable information that you will not hear anywhere else in the current debate, and I strongly recommend the reading of it. I had the opportunity to hear Professor Herzlinger speak recently. It was a very enlightening talk. Much of what I have to say today is taken directly from her own talk or from the book. What is the problem that has caused so much debate within our society regarding healthcare? Many of us are familiar with this, but the facts are stunning. We spend 17% of gross domestic product on healthcare. Despite that, many millions of Americans are either uninsured or are underinsured. Even with insurance, too often our care is dictated by entities who do not share our interests as patients. This is certainly true of the government. If the government is providing our health care or paying for our health care, its principal interest today is cost containment, not whether we get the care that we need. The same is true for the insurance that is provided through many of our employers. The very large national health carriers, the ones whose names we know, Anthem, Aetna, Cigna, United, Humana, have a distinct interest in cost control and much less interest in seeing that we get the care we believe we need. What is the proposed solution? In my view, the proposed solution is more of the same. The proposals that are currently being debated in Congress involve more government involvement in our health care and a larger role for these very large nationwide insurance carriers. They anticipate being the carriers of whatever new plan comes out, and they will insert them and their policies and procedures between us and the care we need. In this current debate, as I said, I believe that a number of people and entities are being heard, and some important ones are not being heard. Who's being heard? Well, politicians certainly are being heard. Also, healthcare policy makers, academics, people we refer to as policy wonks. Insurers are being heard, hospitals are certainly being heard, and drug makers are being heard. I find that practicing physicians and their patients are not being heard in the current debate. I would also add that patients and physicians are allies in the current struggle, and we should never let anyone divide us. I'm going to address a number of myths as I speak, and one that I would like to address to start with is the notion that you must be a member of the American Medical Association in order to practice medicine in the United States. This is a very commonly held belief, and it is simply not true. Many physicians are not members of the American Medical Association. I myself have been a member only for a few months during my entire career, and I've let that membership lapse. So when the president tells you that physicians are behind his proposals because the AMA is behind it, he is simply not being honest with you. I personally know of no physician who supports current proposals in Congress. I know that as soon as I say that, there will be a physician out there somewhere who says, oh yes, I do support these proposals. And I know that there are a few such physicians. But I must tell you, those of us who own and manage our own practices are overwhelmingly opposed to the current trends. I'll illustrate this with a recent survey conducted nationwide among physicians. This survey was mailed to all primary care physicians in the United States and to many specialty physicians. This reveals some of the realities of a physician's life today. This graph appeared from that survey, and it reveals some disturbing numbers. You will see here that 12.2% of physician practices currently report that they are unprofitable. That means they are currently losing money. Another 22.4% say that they are just at a break-even point. Combining those, about 25% of all physician practices currently are just at a break-even point or are losing money. And any shift in reimbursement downward will cause more physician practices into an unprofitable or even bankrupt situation. You will see also that only 17.5% of practices report being both profitable and at a healthy level, whereas just under 50% are profitable but at low margins. Now, I know that some people think it's not appropriate for a physician practice to be operating at a healthy profit, and this is a profound mistake. Have you been to a physician's office where the wallpaper needed to be replaced, where things just looked tawdry and shabby? That's a marginal physician practice. Does it make you feel confident to be in a healthcare situation like that? I doubt that it does. You should want your physician practices to be operating at a healthy margin. More information from this survey is likewise disturbing. 65% of physician practices report that Medicaid, a government program for the poor, pays them less than it costs to take care of those poor people. Just under 45% report that many of the typical insurance plans they accept pay less than the cost of care. 36% of practices report this for Medicare, the government program for the elderly. Other insurance programs, other government health programs also pay less than the cost of care. The results of this survey have profound implications for our state, for our local communities, and for the nation as a whole. Consider these disturbing findings. 78% of respondents believe that the U.S. has a shortage of primary care physicians. Just under half, 49% of the physicians said that in the next 3 years they plan to retire or decrease the number of patients that they are seeing. 60% of physicians do not recommend medicine as a career. I don't. When young people approach me about entering college and entering medical school for advice about how to do this, my first advice is to consider some other career. 94% of physicians said that the time they spend on paperwork has increased in the last 3 years. And over 80% of physicians say that if current Medicare cuts are made, their practices will be unsustainable. That is, they will fall into that unprofitable category I mentioned earlier.